Welcome back to the Doctor is In television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon here in beautiful Monterey, California. Thanks very much for joining us for this important segment. I'd like to talk about one of my favorite issues in my practice in all of plastic surgery, and that's preparing for your consult to discuss the natural neck lift. Many of you have heard about the natural neck lift, and we're delighted that many of you have called and scheduled consultations, and many of you are sitting with me and my wonderful staff to discuss the natural neck lift. I'd like to first talk about some basic principles before we get on to the natural neck lift. Again, one of my favorite procedures and favorite topics in my practice and in all of plastic surgery. First of all, when you come in for a consultation to my office, I'd like you to be able to describe what it is that you want to change. We will look at your photographs together, or we will look in a mirror together. I like to look at photographs from you from prior years if you have any. Whatever you have, high school graduation, college photo, even driver's license. And we can take photographs, high quality photographs here in the office as well. And we have a very powerful tool, a very powerful communication tool. It's called the Vectra. It's a computer system with 6 cameras attached to it. You sit in front of it and you have your image taken. It's very much like a camera. And those 6 images are fed directly into the computer. And you can see yourself in 3 dimensions. We can do some surgical sculpting. We can give you an idea of what your surgical result may be like. However, what I feel is for patients, it's a very powerful tool of communication. You can point out things to me and see yourself from different angles, from the side, from underneath, etc. It's a very, very important, very helpful, powerful tool of communication. And of course, we like to sit together in the mirror, and I like for you to describe to me what it is that you want to change. I don't always find it very helpful when a patient schedules or on the telephone or even in consultation tells me the operation that they want to sign up for or the operation that they think they need. I think it's always more helpful for them to describe what they want to change, point out to me what they feel should be rejuvenated or tightened or firmed, etc. That way we can sort of start on the same page, so to speak, and go from there. Again, to review, we've spoken about the triangle of beauty. There's 3 parts to the triangle, and the triangle sits on a foundation. The first part is the skin. That's the texture of the skin, the very superficial part of the skin. We've spoken about the epidermis is on top of the dermis, and the dermis is on top of the subcutaneous fat, and then there's the fascia, and then there's the muscle, and then there's the periosteum and the bone. We can go through that anatomy step by step. But we start by examining and talking about the first part of the triangle. That's the skin, that's the texture. Fine lines, pigmentation changes, dyspigmentation, etc. What's the skin like? Number 2, we need to talk about and examine the volume changes. As we mature, you've heard me say this before, as we mature, we tend to lose fat in our hands and in our face, and we put that fat on in our trunk. That's an unfunny practical joke, but that's the way it is, both for women and men. I would say it's to a larger degree for women. There are hormonal changes with time as we mature, but it goes, I think, hand in hand with the changes that men see as well. So we lose fat in our face and in our hands, and we put the fat on in the trunk. Now, the third part of the triangle is what most people consider plastic surgery, and that's to look at and consider repositioning the soft tissue. That's the overlying skin, and to look at the amount of soft tissue, look at the amount of skin. So again, let's recap. 3 parts of the triangle. That's the skin surface, that's volume changes, and then there's soft tissue amount and position. So all of the triangles, or the triangle of beauty I say, rest on a foundation. What do I mean by the foundation when we're talking about facial rejuvenation or the natural neck lift? We need to look at the chin, the nose, the cheekbones, the neck itself, sometimes the trachea, the hyoid bone, which suspends part of the musculature in the neck. Sometimes we modify the foundation. We might bring the chin forward, we might augment the cheekbones, we might shave the trachea, etc. But for purposes of discussion and for your consultation, we need to look at the triangle, the 3 parts, the skin, volume, soft tissue position on the foundation. Those are the deeper structures, the bony foundation. And I should also mention the ears. Some people want to modify their ears or their nose. Those are deeper structures of the foundation. So the natural neck lift. Keep in mind, please, that the natural neck lift is a system of analysis. We look at your anatomy. We listen to what you want to change. We consider your health. If you want something done in the office, do you want something done in a general, etc. And after a careful analysis, studying your anatomy and your goals, we can custom design approach for you, resulting in a natural approach. So, as you've heard me say before, high quality, effective, safe plastic surgery starts with an accurate knowledge of the anatomy. Of course, I'm a board-certified plastic surgeon. I've been in this area. What I mean in this area, I've been inside the neck, all layers of the neck for way over 20 years. I'm familiar with the anatomy, and so what we need to do is to review, examine you, look at your anatomy, look at your pictures, your vector image, discuss your goals about where you would like to go, what you want to change, and we can custom design approach for you based on your anatomy and your desires, etc. So I have reviewed the anatomy. Of course, it's the skin. The epidermis is on top of the dermis. Then there's a subcutaneous fatty layer. There's the muscular layer. In between the fat and sometimes on top of the muscle is the fascia. Then there's the periosteum and in the bone. Now I want to mention a couple of the things, particularly for the neck. Underneath the muscle, especially underneath the platysma muscle, there are glands and there are fat collections. And oftentimes those fat collections, sometimes the glands will actually get larger with time. You might think of it as a sort of mid-face descent. As we lose fat in the face and in the hands, of course, that allows gravity to pull down on the facial structures. It allows for mid-face descent. The jowls get heavy and the neck can get heavy. And sometimes accompanying hormonal changes, there can be increased fat in the neck, in the subcutaneous layer, and also below the platysma muscle. And we'll go step by step. So when we start to talk about the skin of the neck, I want to remind you that we need to be very careful. We need to be very judicious when we discuss skin rejuvenation of the neck. Oftentimes for skin of the face, I will prescribe a skincare program. I'll suggest that we follow your dermatologist recommendations. I'd like you to see our esthetician. Oftentimes I'll have you see our aesthetic nurse. And so we can prime up your skin for something like a TCA peel, trichloroacetic acid peel. That's a kind of an acid wash that I do under a totally numb face in the office or under general anesthesia in the operating room. It's very similar to a laser, and sometimes we will prescribe a certain type of laser to resurface or rapidly regenerate, encourage exfoliation and regeneration of the skin. Now, I need to emphasize that we need to be very careful, very judicious when we talk about rejuvenating the skin of the neck. That's because the skin of the neck has far fewer appendages than the face, far fewer sweat glands, sebaceous glands or oil glands, far fewer hair follicles, and so we have to be very careful as we consider any treatment to help rejuvenate the skin of the neck. But that being said, it's important that the neck is moisturized. We can slowly encourage gentle exfoliation, and we encourage regeneration, etc. In other talks and during my seminars, we've talked about the 6 essential steps to skincare, and certainly that applies to the neck. However, we need to be very judicious. I've said that about 3 times now. Very careful with resurfacing, when we consider resurfacing at all for the neck. So, but we need to look at the skin, of course. Next is the subcutaneous fatty layer. So, how do I affect the subcutaneous fatty layer if a person has excess baby fat or excess subcutaneous fat? My favorite way to affect that layer is with microliposculpture. That's where I make a tiny little incision in the submental crease. Most Americans that I meet have a little scar there anyway. You know, I think your brother may have pushed you, or you fell down the stairs, or you tripped on the curb, or you fell off your bicycle, etc. But I would say 80 or 90% of Americans that I meet already have a scar underneath the chin. So I make a very tiny incision in the submental crease. I make a little incision where the earlobe meets each cheek on both sides, and that enables me to put in a cannula. It's a tube, and I can vacuum out the fat. microliposculpture, a very fine cannula. It's almost like a large needle. I can do this in the office. We numb up the skin. I numb up the deeper tissues. Some people elect to have oral sedation. They take pills to get very mellow. And so I can mold and shape and tailor with microliposculpture. Now, something I want to emphasize is when I do microliposculpture, that's me suctioning, molding, shaping, and tailoring. It's not a procedure with a laser probe or a heat probe or a sizzle probe that's inserted by a technician, and then they flip a switch and plug the machine into the wall, and they leave for 20 minutes and come back. Meanwhile, they expect that the little stick or probe attached to a laser will sizzle the fat away. It's not that at all. This is molding, shaping, and tailoring as we go, because I think there's a very specific desired contour based on your anatomy that we desire. We like a strong chin, we like a firm, crisp, clean neck, we like well-defined mandibular angles. So keeping that in mind, molding, shaping, and tailoring as I go. It's a handmade procedure. It's done by hand. That's me operating. So sometimes people come in, and of course, many of you have heard about Kybella. Kybella is an injection. Deoxycholic acid is very similar to what your liver produces, very similar to bile. It's stored in the gallbladder. It helps dissolve fat, and that's what Kybella does, dissolve fat. It's typically a series of injections. There's no anesthetic given. You don't need to be put to sleep. I would say the downside is it takes more than one treatment. You get markedly swollen, markedly edematous for a few days after the procedure. It oftentimes is repeated or needs to be repeated. However, the plus side is it's not surgical, and you can greatly reduce the amount of subcutaneous fat. What about Coolsculpting? There are some applicators where we can apply the Coolsculpting applicator or machine. Coolsculpting, essentially, in summary, is a vacuum device attached to a computer. It vacuums or sucks up the skin, and in between the skin there's the subcutaneous fat. The computer lowers the temperature. It takes about 55 minutes. And over the course of the next, say, 4 months, between 18% and 24% of the subcutaneous fatty layer will be absorbed by the body. Now, again, that can be effective. There's no anesthesia. There's no downtime. But again, microliposculpture is a tailoring, sculpting, molding process. Coolsculpting is the application of a machine. And so really, you need to consider all your options carefully, and we're happy in our med spa to offer you different options. So I talked about the skin. I talked about the subcutaneous fatty layer. Another way to mold and tailor the subcutaneous fatty layer is what we call a direct lipectomy. Sometimes I'll make a little incision, a curved incision in that submental crease, where I can go in and I can actually look at the fat. I use magnification and fiber optic lighting to keep the incision small. It's not like a sort of old-time neck dissection where a very long incision is made and the skin is opened up, and you can affect the anatomy of the neck quite dramatically. This is through a smaller incision with fiber optic lighting and loop magnification, and I can sculpt the fat with a scissors or a bovie, electrocautery, etc. And I can sometimes do that from the side as well. Now, what about the next layer? The fascia is the connective tissue in the body. It overlies the muscle called the platysma, and then there's the muscle, the platysma muscle itself. For any of you who ride horses, you'll probably know what the platysma muscle is. The horse, of course, has a very long, kind of a giant mandible or jaw. The platysma muscle runs from that jaw, that mandible, 3/4 of the way down the body. And the comparative anatomist will teach us that that's how the horse shivers. It shivers off the fleas and the flies, in addition to its tail. In our species, in mankind, the platysma muscle runs from the jaw or the lower face down to the clavicles, and it can go beyond the clavicles, but it stops there. It's what we call vestigial in our species. It's vestigial. It's like the appendix. It's lost its function. It has no other function other than to give plastic surgeons work. And of course, I'm delighted that it gives plastic surgeons work, because when the platysma muscle gets lax, it can cause cords. It can cause what people sometimes call the turkey neck. Sometimes people come up and they grab that tissue and they say, "Doc, I want a waddlectomy." I hear these stories about their grandkids jumping up onto their lap, and the kids grab that tissue and say, "Grandma, Grandpa, what is this?" And looks like a turkey gobbler. Kids say the darndest things. They don't intend to be mean, but they can sometimes bring attention to something undesirable. In any case, when the platysma muscle is lax or loose, it needs to be addressed. That's called a platysmoplasty, where I firm up, tighten, recontour the platysma muscle. Sometimes I take out a little bit, but most often it's by tightening, firming, repositioning, as I do for the structures of the face, or the SMAS layer, the SMAS layer, which for those of you who like to read about things on Google, the platysma muscle is contiguous or extends onto and goes on with the SMAS layer. That's the superficial muscular aponeurotic system in the face. That's like a fascial layer that we can sometimes reposition, tighten, use to rejuvenate the face and give a more youthful, natural appearance as opposed to really pulling hard on the skin. So a platysmoplasty can be done through a short incision, curvilinear incision in the submental crease as well. I can tighten up that medial part or midline part, and then I oftentimes come from the side, from behind the ears, or sometimes under the earlobes, etc., to gain access to the platysmal muscle from the side. So I can redrape that, tighten it, firm it up, smooth it out, and that can be very effective to correct those platysmal bands, to do a platysmoplasty. Now, I would like to emphasize that it's very difficult to get a platysmoplasty to last forever. That muscle is dynamic. It's going to contract. For that reason, sometimes I'll use Botox, and I'll return to that. But oftentimes, it's the first part of the neck rejuvenation to sort of become lax again. Please keep in mind, any kind of plastic surgery is not a reversal of gravity. We don't suspend the laws of gravity because time marches on. But what we aim to do is smooth out the platysma so we have a crisper, cleaner, smoother, tighter neck and jaw and chin line. I think that's desirable in an attractive face. It serves as the foundation for an attractive face, a beautiful face, in both women and men. So I think that platysma can be very, very helpful. Now, I want to back up for a moment and talk about Botox for minor platysmal bands. Now, what about the platysmal bands, those cords in the midline or on the sides of the neck that aren't too bad? A person maybe is not yet ready for surgery, but they do want some improvement. Botox can be very helpful. Keep in mind that Botox is a muscle relaxant. It's different than a filler, such as Juvederm, Belotero, Voluma, etc. I like Botox a lot around the eyes in the periorbita. Another use for it is for a platysmospasm or the platysmal bands, cords. What that allows is for the platysmal muscle to relax. Instead of being taut and tight, then those bands will oftentimes fall back and give a much more desirable contour. Now, what about going below the platysma? Certainly there is some subcutaneous fat. There are the submandibular glands, which make saliva for the major glands underneath the tongue. I'm comfortable addressing that fatty layer underneath the platysma, especially in the midline. What I mean by the midline is between the Adam's apple and the chin. I'm very comfortable with that. I'm cautious but comfortable sculpting the fat, removing some fat, tailoring the fat as we go to the side. I'm very conservative and very judicious with addressing the submandibular glands, those glands that make saliva underneath the tongue. Certainly those glands can be shaved down when they're very large. They can even be removed, but I'm very judicious about that. I think there are few, very limited indications, so I certainly do not do that in every natural neck lift. But certainly it can be done. Oftentimes people will come in and they say they may have had a facelift elsewhere or a neck lift elsewhere, and they have these bulges and they don't know what the bulges are. Oftentimes that's either the fat underneath the platysma muscle or they're quite large submandibular glands, and that can be discussed. Now, one step further, as I said, there are foundational changes that we can effect. We can bring the chin forward. We can add fat. On rare occasion, we want to set the chin back or the jaw back. We can shave the trachea. That's akin, very similar to building up the cheekbones or advancing them, reducing the nose, reshaping the nose, reducing the ears, etc., minimizing the size of the earlobes. That's something that we can do. because oftentimes with time the earlobes, the ears will get larger as a person matures. Now, in terms of the natural neck lift, let me back up a little bit. I did talk about the surface of the skin. Well, what about when there's actual extra skin or when the skin has lost its resilience? Oftentimes what I find is repositioning the skin to a higher position, to a higher level, as opposed to just removing. I think that will oftentimes be very effective. Again, with time, you've heard me say this, as we mature, we tend to lose fat in the face and in the hands, and we put that fat on in the trunk. Oftentimes the fat we either accumulate in the neck with mid-face descent, and sometimes there are hormonal changes whereby the fat can actually hypertrophy and get more fat, either under the platysma or in the subcutaneous layer. We like to reposition that volume because volume can be good, fat can be good. Now, when there is extra skin, when the skin has lost its resilience, I can do a number of things. I can remove some from under the chin. Oftentimes, or I should say more often, I can make incisions in back of the ears or under the earlobe. It can be combined very frequently with something called the jowl lift. When people have prominent jowls or saggy jowls, I can make an incision just in the crease, either within the ear, within that what we call the tragus, or in the crease just in front of the ear, under and around the earlobe to the back, and sometimes into the hair or the hairline. Through that incision, we call it a peri-auricular, or around the ears incision. I can tighten up the skin, I can remove some, I can reposition it. So that can be done in combination with the incision in the submental crease. So once again, to review, the natural neck lift is a system of analysis looking at your anatomy, discussing your goals, all with the goal is to custom design an approach for you, resulting in a natural look. A crisp, clean, smooth, firm neckline, jaw, and chin is very desirable for an attractive face. In both men and women, it serves as a beautiful frame or foundation. If you would like to learn more about the natural neck lift, or you have any questions about any facial rejuvenation procedure or body contouring or breast surgery, hand rejuvenation, etc., I hope you'll go to my website, drmorwood.com. That's D-R-M-O-R-W-O-O-D. Excuse me. That's my website, drmorwood.com, or call 831-646-8661. Once again, I'm Dr. David Morwood. I am a board-certified plastic surgeon here in beautiful Monterey, California. This is the Doctor is in Television program. We're going to take a very brief pause for a very good cause.
It's scary making the decision to have reconstructive surgery, but it's so worth what you get out of it.
I'm stress-free. I know I'm not going to get breast cancer.
Everything is back to normal, and it really did not take long to bounce back.
I have a sense of hope for other women that this surgery can help them to live normal lives.
This year, more than 200,000 women in this country will be diagnosed with breast cancer. For many of them, a mastectomy or removal of the affected breast will be recommended as part of the cancer treatment.
The idea of losing a breast for some women can be almost as difficult as being diagnosed with breast cancer. Modern breast reconstruction can help. The purpose of this presentation is to provide women with valuable information about the major issues in breast reconstruction.
We'll have an opportunity to speak with women who chose different methods of reconstruction. We'll talk to experts in the field of breast cancer, and we'll let you know your options for breast reconstruction.
I embraced the mastectomy and reconstruction procedure, and because of that, I had a terrific outcome, and it's changed my life in a positive way.
For the thousands of women who will be diagnosed with breast cancer this year, we understand this is most likely a troubling and frustrating time. We hope this presentation's been valuable to you and will help you make some very difficult decisions that you're facing.